Hey, welcome to another video from Skinny Medic. In this video, I want to talk about the Halo vented chest seals. So we use chest seals for penetrating injuries to the chest, abdomen area. This is holes in the chest, holes in the abdomen, holes in the back. You want to typically put a chest seal on them. You guys may have noticed that I said that we're going to put a chest seal over the abdominal area. And this is correct. You may have that patient that a bullet enters into their stomach, travels up, and then hits the diaphragm, and then maybe enters the lungs. This is still a respiratory problem, so we need to seal that area up. Even if it's at the belly button, you're there, just put a chest seal over it. Now, if the intestines are hanging on your patient, that's another treatment plan. We're going to put some moist dressing if we have it, use a pressure bandage. That's a whole nother treatment plan. This is just you have a hole or a slice or something like that in the abdominal area. There's no intestines hanging out. We can put a chest seal over that. We'll take a quick look at the package here. You do have 4 pull tabs. It's going to help you open it up. Got some directions here. Also have directions on the back side. Alright, so we'll open up these and kind of take a look at them quickly. You're going to get 2 chest seals here. One is a vented chest seal, one's a non-vented chest seal. Also, the pack is resealable. I like that. Let's open this up. So, we have a non-vented chest seal and a vented chest seal. Let's kind of talk about their theory. Alright, so we'll take a look at our patient right here. We've already taken care of any kind of massive bleeding that we need to take care of. Arms, legs, and all that's just pouring out blood. We've got taken care of. We've also taken care of any kind of airway issues that we need to take care of. Now we're on to respiratory. So we're looking for any kind of holes in the chest. So let's pretend that my buddy has a hole in the chest right here. Okay? So you could put a gloved hand on, that works as well. If there's any kind of blood coming out of it, we'd want to take a 4x4, 5x9, wipe away any kind of blood so we can get a good seal with our chest seal here. I would use the vented chest seal on the top part here. We're going to roll them in just a second and look at the back side. If the back side has a hole in it, that's where I would use a non-vented chest seal, because if we have our patient laying on our back, then this chest seal on the back probably is not going to vent very well. So we can put the non-vented there. This is probably where it's going to vent. Even if we set our patient up and he's leaning against a stretcher, leaning against a tree, that, this back seal probably is not going to seal the best. So that's why we'll put our vented chest seal in the front, log roll him, and look for a exit wound or an entry wound, whatever. Another hole. Maybe he was running from the guy. I don't know. So, got a hole here. Pull the tab. Put this hole over the center of our pretend hole here. Doesn't really matter which direction you put this in. Okay. Push it down to get a good seal. Okay, we're good. Now let's log roll him. And we have another hole here. Whether that be an entry or an exit wound, have another hole back here. So then, pull out your non-vented chest seal. Secure it. Log roll him back over. And he's good to go. So we'll take a little bit closer look here at the vented Halo chest seal. We have a large tab here. This is going to help us placing the chest seal onto the patient. And also, for whatever reason, if the chest seal needs to be burped, then we have easy access just to pull, relieve the pressure, and then seal it back onto the patient's chest. So if we see on the outside of the edge here, we have an outer band of material, and it's a little bit different than the sticky material on the inside. So it's going to help make a better seal on the outside so that the chest seal will vent. The blood or air is going to come out of the hole here, and then I hope you can pick it up on camera. Should be able to pick it up when we actually use it. You can see the little color change right there. There's a hole there. We have a hole here. We have a hole right here. And a hole right here. So blood or air is going to come through the bottom side of the vent, come into this top section here. There's actually 2 pieces of material here. You can kind of move this top layer here. So air is going to come, or blood's going to come up through this hole and then escape out the vents here. So we'll take a little bit closer look at the underside of the chest seal here. So we have the super sticky side here, and then right here in the center you can see it's not sticky. So this is where air is going to travel up in and go towards our vents. It's going to go down either side. Here, blood can also go down through here as well. In the packaging, you also get a non-vented chest seal, so no vents here. This is just a super sticky pad that you're going to place on the hole. So we have our Techline Trauma gunshot wound in a box. This is normally used for wound packing, but I do like to use it for chest seals because it does show blood coming out of the injury, and we can see our vents working. Hopefully this works. We'll give it a shot. So we have a gunshot wound. This is to the chest area, so we don't wound pack it. We just put a chest seal on it. So pull off the chest seal. Apply the chest seal with the hole of the vent over the hole of the injury. Make sure I get a good seal here so we can hopefully see the vents work properly. Alright, so let's see how this is going to work. Okay, you can see it's sealed up. Okay, and now you can see it's going to start moving towards the vent. You can see it come out the vent holes here and the vent holes here. See if I can get it to come out the other vents. See, it's starting to come out this, there you go. Come out that vent, so we are coming out all the vents. I will say that one of the downfalls of the Halo chest seals is the packaging. So here, just to kind of show you an example, we have the Condor rip-away bag. This is a little bit larger bag, but these fit nicely in there. You can fold them, no problem folding these, and then they'll fit tucked down into there. But if you have a smaller bag, such like this bag here, a little more difficult. I'm not saying you can't be done, but it's a little more crammed in there. They'll still fit. Put your tourniquet, pressure bandage, works just fine. While I've got you here, I just want to go and show you that you can put the Halo, a tourniquet, and a pressure bandage in this smaller pouch. Like this is my Skinny Medic pouch, which is made in America, but it's pretty similar to the Condor EMT size pouch to kind of give you an idea for reference. But this fits in there very nicely. So I hope this video helps. You never know when you'll be the first responder, moving the right gear and the right training. In this video, I want to take a look at the Halo vented chest seals, which are upside down. And hopefully I don't touch this gun because y'all seem to freak out when it moves on video.